Hello guys, welcome back to my channel. This is Dr. Najib and I am here with the information of Covid-19 as someone asked me for this. This video is educational purpose and let's go and get started. If you are visiting my channel for the first time, then don't forget to subscribe. This channel is for those who are interested in medical. So for now, let's get started with Covid-19 lecture. And I am making this video on April 17. Obviously things could change from this time. As things could change, we will try to continue things updated. Okay, this is as it is right now. It is similar to especially Sars virus. If you remember, SARS stands for Severe Acute Respiratory Syndrome in 2002. They believe that it is mutated from the bat in such a way can infect another immediate host. So it is transmitted from bat and infected to what they believe is civet. And from civet it is enough to mutate and infect a human being. After a decade in 2012, again coronavirus causing MERS stands for Middle East Respiratory Syndrome. And again in bat where they mutated and transmitted into the next immediate host believed is camel and then mutated enough to infect human. Okay, this is all about MERS virus in 2012. And what about 2019, where we now talk about coronavirus 2019, particularly COVID-19. And again we believe that the virus underwent mutation in bat and then has the ability to mutate into a pangolin and after that to a human and cause a COVID-19. Without wasting much time, let's talk about its pathaphysiology. And they think that there are two ways. One is fecal oral transmission. And what happens is someone goes to bathroom and they share the virus and wipe their bottom and they don't completely wash their hands and touches the other surface in the bathroom. And some mother comes in and they touch the surface and potentially get infected. And the other is by coughing or sneezing. And they believe that it could be infected to other person who is max 3 feet distance and respiratory droplets could stay on surface and could survive approximately 24 hours. And the interesting thing is that if someone who is asymptomatic, who is not showing any symptoms, can also spread and infect the other person. Once it gets into the respiratory system, it attaches to the alveoli. So let's zoom into the alveoli and look at the alveoli. Once it comes into alveoli, it attaches to the type 2 pneumocytic cells. And what are these cells? As you remember, in alveoli we have two types of cells. Type 1 pneumocyte cells and type 2 pneumocytic cells. Type 1 pneumocyte cells are for the gas exchangers, whereas type 2 pneumocyte cells decreases the surface tension and thereby reducing the alveolar collapsing. And for now, in these type 2 pneumocytic cells, the viruses get multiplied and after that they destroy the type 2 pneumocytic cell and they release the inflammatory mediators. And these stimulates the macrophages to release interleukin 1 and interleukin 6 and these comes into the blood and causes the vasodilation and also makes the cells to shrink and thereby makes the capillary permeability to increase. Okay, and by doing this, all these plasma leaks out into the interstitial spaces and all these fluids accumulates outside the alveoli and tries to compress the alveoli. On top of that, some of the fluid enters into the alveoli and causes the increased alveolar edema and it's technically drawn out surfactants. And what are these surfactants do? If these surfactants is drawn out, its surface tension increases and what's next? As we know, pressure is directly proportional to the tension. So if we increase the tension, it automatically collapsing pressure increases and therefore it leads to the alveolar collapse and that's the big problem. Because I have tons of fluid accumulating around the alveoli, so which is making difficulty for the gas action and therefore decreases the gas action. And this leads to the hypoxemia. And this hypoxemia is very dangerous and thus increases the work of breathing because I have to work hard to inhale as much as possible to not only to open the alveoli but also these interstitial fluid. That's the significant difficulty and that's one thing. And also these interleukin 1 and interleukin 6 stimulates the neutrophils and these come into the blood and enters the alveoli to kill the viruses. How do they do that? They release the reactive oxygen species and they release the proteases, as you can see here. Whenever these they release the reactive oxygen species and proteases, it might destroy some of the virus. And guess what is going to happen? it ends up in destroying the cells also. That's the big problem. If these are destroying type 1 and type 2 pneumocytic cells, what literally I'm doing? I'm decreasing the work of gas exchange and also increasing the collapsing pressure, and therefore ends in collapsing the alveoli. On top of this, what I am having at the center here, I am having the collection of type 1 pneumocytic cells, type 2 pneumocytic cells, and also I am having some of the macrophages, and also I am having some of the neutrophils here. And this leads to a stage called as consolidation. And this consolidation is a big problem, okay, because this is also going to alter the gas exchange, and this leads to the hypoxemia. And the other thing is that you are releasing tons of interleukin 1 and interleukin 6 into the blood. It can travel all the way into the CNS. Okay, there we have the hypothalamus, and this hypothalamus controls the temperature, okay, and therefore this interleukin 1 and interleukin 6 tells the hypothalamus to increase the body temperature, and this leads to the fever, right? Then this is the most important and significant feature. Okay, that's enough. And they will have fever. And what else? If someone has the consolidation, guess what happens? If he is going to cough, as of you cough, you are releasing these stuffs into mucus, and also they have the increased work of breathing and also hypoxemia, and there it ends with infecting the other person. If this information was useful to you, and then don't forget to subscribe and like video. Okay, let's meet in another video with different concept. Okay guys, thank you.